Don't forget, diabetes, like honey, like sugar, sugar is sticky and it sticks everywhere. Don't let diabetes be a sticking point for you. All right, hi everybody, this is Dr. Patel. Today we're gonna talk about diabetes. Unless you live under a rock, I'm sure you've heard about that term, but has your doctor or anybody really explained what diabetes means? As you know, diabetes is a worldwide problem. I would consider it to be a pandemic. With sugar, with processed foods on the rise, with what we're eating, the amount we're eating, the ingredients that we put in food, there's a lot of concern with diabetes growing around the world. Most concerning is that our younger population, aka kids and adolescents, are now developing diabetes at a rapid rate. This is very concerning and can affect not only the patient and the person, but the entire healthcare system. So I thought we'd start off with just plain old explanation. What is diabetes? Simply put, diabetes is sugar. Sugar in your blood, sugar in your urine, sugar everywhere. What does sugar do? Sugar is sticky in nature. Think of honey. Imagine this honey and I pour it out all over this piece of paper, but more importantly, imagine this honey being poured all in your body. What do you think is gonna happen with that honey? It's gonna stick, because you know what sugar and sticky things do? They stick. But where do they stick? They stick everywhere. That's why diabetes is a whole body problem. A lot of people don't feel their diabetes. Well, I would hope you don't really feel it because you don't want to feel sticky. But the reality is that diabetes and that sticky blood is doing the damage in silence. Now, if I told you to go home, get some honey, go in your car and pour it all over your seats, all over your trunk, all over your steering wheel, and then sit in it, would you do that? Sounds crazy. That's what's happening inside your body if you have diabetes. Things are sticking where they should not. And what happens when you have that? Things don't move. For example, if I poured this honey into a cup, drink it out of a straw, would you be able to drink it? I highly doubt it. Because it's so sticky, it's hard to go up. That's basically what's happening inside your body. Things move slowly, things get blocked up, things cause issues, including inflammation and other issues. For example, for those with diabetes, especially if it's not controlled, you can have eye problems, aka retinopathy. You can have kidney problems, aka nephropathy. You can have problems with your nerves and feet, aka neuropathy. That's just a few. Now, of course, you have increased risk for heart disease. They even say that diabetes is considered a huge risk factor for dementia and Alzheimer's. Just think about it. Things are sticking everywhere, so things cannot move. It's very simple in that sense. So of course, with that in mind, is there stuff that we can do? Sure, let me give you 10 pills. It's problem solved. Is that really what you want? Do you really just want to take a bunch of pills? Is there not anything else that we can do beforehand? Luckily, there's a lot of stuff that can be done, but the power is within you as always. So before we jump into what medications are available, I'd like to start with just backtracking and saying, how do we even check for diabetes? The number one thing is blood work. Back in ancient Greek times, they would check diabetes two different ways. One, they would take a cup of water and wait, or they'd have you pee into a cup of water and see if ants crawl towards it. Because ants are attracted to sugary and sweet stuff, including water. So if they notice that, you know what, the ants are lining up, you might have diabetes. Number two, they'd have you pee in a cup and the doctor would drink the urine to see if it was sweet in taste. Luckily, I'm very grateful that I did not practice back in ancient Greek times. We've come a long way since tasting somebody's urine to see if you have diabetes. The easiest way to check is your blood work. Fasting blood glucose. Any fasting blood glucose over 200 is considered diabetes right off the bat. There are other ways to test, including A1C, which is another way to check how sticky your blood is. So what are different ways to check for diabetes? Number one is your blood work. Now, when you get a blood test, they usually do something called a basic metabolic panel, hopefully a complete metabolic panel. You want to check for your fasting blood glucose level. If your fasting blood glucose level is over 100, automatically considered diabetic. So that's one. Another way we check is A1C. I'm sure you've heard about that. If not, please get tested for that. It's a very simple, cheap blood test. What it does is it checks how sticky are your red blood cells. Basically, it's called hemoglobin A1C. So it checks to see how glycosylated or how sticky are the red blood cells that are currently circulating in your body. It's usually determined as a percentage. The idea is if it's 5.7% or less, technically, that is normal. So basically 5.62 lower is equal to a normal sugar. If your percentage or A1C is 5.7% to 6.4%, that is considered pre-diabetic. If it's over 6.5%, by definition, you have diabetes. In layman's terms, that means 6.5% of the circulating red blood cells in your body are sticky. So that means 6% of your blood is sticking to places where it should not be sticking. Luckily, the A1C, we check it every 3 months. And the reason is because your red blood cells are always being destroyed and new red blood cells are being created. And that process can take about 3 months. So those are usually the top two simple, ineffective ways to check for diabetes. Obviously, there are a lot of other tests now being used. I also like to check something called a fasting insulin level, because usually what is the root cause of diabetes or having too much sugar in your body? It's insulin resistance. Insulin is made by a little organ called the pancreas, and the insulin's main job is to help take sugar out of the bloodstream into your cells. Think of it like the doorman that opens the door for sugar to come into your house. Now, if you keep eating sugary stuff, you have a lot more visitors. So doorman needs more doormen. You need to hire more doormen, AKA your insulin levels go up. Now, if your doormen are working 24 hours a day, they might get tired. They might need a break. So what happens? They start to burn out. Hence, insulin resistance. So that's why it's so important to eat well and take care of your pancreas. Now, let's say you've been diagnosed with pre-diabetes or diabetes. As I mentioned, do you really want 15 pills? Do you really want to start medicine? Is there nothing in your power that you can do? Are we just doomed? Whatever, let's just take pills forever. Is that really what you want? I really hope you said no, because I genuinely do not like to prescribe medicine. If I can, I'd rather you help yourself before I have to help you. So simply put, what are things that you can try on your own? Drink water. Your blood is sticky. If I told you to put honey on your hands, how are you gonna wash it off? Do you wash it off with more honey? Probably with water. Water is an incredible solvent and can help kind of wash out your blood. Like I said, sugar tends to attract water. So a lot of diabetics actually feel thirsty because they're actually peeing out a lot of their water and they get dehydrated. So water is one of the simplest things. On average, you should drink a minimum of 64 ounces of water per day. That is equivalent of 4 water bottles. Other things that are in your power, move it. I cannot stress this enough. If your body works, please use it, please move it. Not once a week, not twice a week, every single day. Whether that is exercise, biking, walking, just stand. We've come to a point in society where sitting is the norm and sitting is the new smoking. I don't know about you, but I personally do not want to develop diabetes because it can affect a lot of things in the future. So take care of yourself by moving today. Now, a little trick that I personally do and I recommend all of my patients is after you eat, don't sit. Stand and move around. And the reason is because your muscles actually do not require insulin to get sugar out of the bloodstream. It's one of the few parts of the body that can suck sugar right out of your bloodstream without insulin. It's pretty cool. It's called GLUT4 channel. Basically, the muscles, as they start to work, they have a higher demand of sugar. They're able to absorb it. So by you walking, or not exercising, but walking after you eat, your muscles are working, your sugar levels will not spike as high, and therefore you may not need as much insulin after a meal. Number 2, move your body. Number 1, water. Number 3, hopefully get enough rest, because sleep affects our entire life, our entire bodies. Think about it. We sleep about 1/3 of our lives. So hopefully it's healthy sleep and restful sleep. When you're sleeping, you can have a lot of healing happen, and that is so key for your body to repair itself. Number 4 is stress. Everybody's stressed, right? Okay, it's normal. Okay, let's move on. Really? Is that a place we've come in society where stress is a normal way of living? It's kind of bizarre that stress is now considered usual and it's okay. Honestly, it's not okay, because stress will always find its way out. It's better you help it find its way out before the stress finds its way out. So if I were you, I get it, life is life. You may have a lot of things on your plate, family, kids, career, whatever situation. Spend maybe 5 minutes a day to de-stress in healthy ways. That does not mean watching TV. That does not mean scrolling. That does not mean alcohol. That means journaling, exercising, meditating, listening to some upbeat music, something that's positive. So those are some of the 4 simple things to do. Some advanced things I always recommend patients is fasting. If you mentioned, I said, when you eat a lot of food or you eat a lot of sugary things, your insulin levels spike. Those doormen are working overtime. They deserve a rest, right? Don't you think so? How often do we give our body a rest? We're always eating, we're always snacking, we're always doing something that involves food. Of course, food is a cultural experience. It's a very intimate experience because it involves all 5 senses, and it's a simple pleasure in life. I'm not here to tell you to eat rice cakes, but the truth is, you will survive if you don't eat a meal. We're the only animals and creatures on this planet that have a fridge. So think about that. So if I were you, you may consider something called intermittent fasting, which includes you eating all your food within a window of time. Instead of the entire day of snacking, munching on little things here, a few things here, you narrow that window. And that would include something like a 16 to 8 window, which means you are eating all of your food within 8 hours. Lucky for you, you get to determine which 8 hours you want to snack or eat your food in. So that is a simple thing to try. If you really want real results though, you're talking about prolonged fasting. Now it's not easy, but it's very doable and can have significant benefits. I'm talking 2 days, 36 hours to 48. The most effects come after 72 hours of fasting, because at that time, your body goes into a process called autophagy. Autophagy means auto, self, phagy, eat. Your body starts to eat itself in a good way. It starts to eat up all the junk and debris that's accumulating in your body. And what else? Your insulin gets a break. Your pancreas gets a break. It can relax. It can just chill for a little bit. By doing that, you're allowing your body to clean itself on a deep level. Your body will greatly appreciate you for that. So those are some of the simple things, or I should say simple things I recommend patients to try. This is a lifelong process. Just because you have diabetes doesn't mean you do it. You should do it before you ever get diabetes. Now let's say you do have diabetes and you're doing all that and it's getting better. Now you're no longer diabetic. Okay, so let's stop all of our homework. You might come back to becoming diabetic. So I always tell patients, this is not a problem, this is a process. It's very important to chase not a number, not just sugars, to chase a lifestyle. Another cool thing is not really what you eat, but how you eat. Obviously, what you eat is important. For example, less carbs, we all know that, but protein and fats can blunt or decrease your insulin response, but it's really how you eat. For example, you might have a plate with rice, beans, chicken, vegetables, maybe a little bit of fruits. Now, for those who go straight for the rice or the fruits, what happens? You're first eating a lot of carbs. So your body releases insulin due to all of those carbs. However, if you were to eat the protein first or maybe the fats, you can slowly blunt that insulin response. So you may actually decrease the insulin that is released just the way and the order you eat your food. The same thing with oatmeal. There's a lot of pluses and minuses that I hear about oatmeal. A lot of people say it spikes their insulin levels, or it spikes their sugar levels, and they get concerned. However, if you add protein to your oatmeal, for example, you eat an egg or two before you eat your protein, or maybe add some protein powder or peanut butter powder to your protein and your oatmeal, that can actually help blunt the sugar response. These are all things that I hope you can do on your own, at the comfort of your house and at your own leisure. Now, let's say you've done all of these things. Doc, I've did everything. I've exhausted all options. My A1C is not going down. It happens. Our metabolism does slow. A lot of other factors can affect metabolism and our sugars. Of course, like I said, not a fan of medicine, but if you need it, you need it. And diabetes is not something I wait around to watch and see before it gets worse. Obviously, I want to give you a chance to help yourself, but at some point, we got to pull the trigger and start something. So obviously, there are medications, as you may have heard, some of the newer medicines, Jardiance, Farxiga, those are called SGLT2 inhibitors. They basically block sugar reuptake in the kidneys, so you tend to pee out sugar. So that's actually becoming a really great drug, especially because it works on decreasing your diabetes and it can protect your kidneys. It has been studied for heart failure as well. Of course, the hottest drug probably known to mankind at this time, any guesses? Ozempic, Mounjaro, Zepbound, Wegovy. You ever heard of those? Those are an injectable medicine that's taken once a week, and it's meant to help basically promote insulin sensitivity. It slows down gastric emptying, which means your stomach stays full longer. It works on different parts of your brain to curb the desire to eat. Like I said, not a fan of medicine, but these guys work. Obviously, all of them come with side effects, which we'll get into in another video. But the whole point is, there's a lot of big breakthroughs in diabetes medicine that can really help. Of course, you have the oldies but the goodies. Metformin is a classic. It's been around for years and years, and it addresses the root cause of diabetes, which is insulin resistance. So I usually like to start patients on Metformin. It's a simple pill, very minimal side effects, and you do get a lot of benefit outside of just your sugar levels dropping. It's currently being studied for Alzheimer's as well. So that's a little bit of an overview of just diabetes. Remember, diabetes is something that is very well in your power to control without me getting involved first. But it takes effort. If you've eaten poorly a lot of your life, it's not gonna reverse in a couple of months. I always tell my patients, yes, we wanna get your numbers down. We want to make sure you're no longer diabetic, but more importantly, I want you to chase a healthy lifestyle, because no medicine is a substitute for healthy living. So I really hope this video was of value to you. If you'd like to learn more, please subscribe to us and our channel, because we'll be putting out a lot of new videos regarding many different medical conditions and topics. Till next time, please take care of yourself and never forget, the power is within you.